first topic is diabetes mellitus. So insulin plays a very important role in this disease. To understand the basics, insulin, it acts as a key that unlocks the cells to allow the blood glucose to enter into cells and provide energy. So what happens in diabetes, beta cells of pancreas cannot secrete enough insulin. This is the first reason. Or the second reason is that the insulin is ineffective at the peripheral tissues. So even if the normal amount of insulin is being produced, the cells, hence the tissues, cannot use that insulin, or this is known as peripheral resistance. This will lead to the hallmark or the characteristic signs of diabetes mellitus, which are hyperglycemia, which means there will be increased amount of glucose in the blood, obviously because the glucose is not being taken up by the cells to provide energy, so the excess is just present in the blood. Now it's in excess. This means from the blood it will be filtered out and some of the glucose will be secreted via urine. So hyperglycemia and glucoseuria are together a hallmark sign of diabetes mellitus. Now another important thing that we need to remember for diabetes is there is weight loss. The animal does not gain weight but lose weight. This is because even if there is excess glucose in the blood or there's glucose in the urine, the cells are still starving. The cells cannot take up oxygen. So what happens in this case is the reserves, the protein reserves, the fat reserves in the body are being broken down because the cells, they don't have any source of energy. They will start breaking down the protein, the fat, and try to produce energy through other mechanisms. This will lead to weight loss. This means that the animal will tend to eat more. So this topic that we are studying will be for both dogs and cats. Now the characteristic hallmark things that we need to remember for dogs and cats diabetes mellitus is there's hyperglycemia, there's glucoseuria, there's polyphagia and weight loss. Now what happens is there's PU and PD as well. Why does polyuria and polydipsia happen in this case? The basic behind this is there's glucoseuria. So there's glucose in the urine. This glucose will lead to osmotic diuresis, which means the glucose is a solute. It will attract or it will tend to take up more water so that more water is excreted out as urine. It will increase urination because of the process known as osmotic diuresis. This will also lead to water loss. So because of osmotic diuresis, polyuria is happening, and because there is polyuria, there's more water loss from the body, hence there will be increased thirst. There will be polydipsia as well. So again, the keywords that we need to remember are hyperglycemia, glucoseuria, polydipsia, polyuria, polyphagia with weight loss. In this case, the animal eats more but loses weight. Now there are two types of diabetes: insulin dependent diabetes mellitus or type 1 and non-insulin dependent diabetes mellitus type 2. In type 1, the pancreatic beta cells are absent or destroyed, so no insulin is produced and secreted. This is important. There is absolute lack of insulin. On the other hand, in type 2 or non-insulin dependent, pancreas secretes insulin normally, but there is peripheral resistance to the insulin. So these are the two main causes that we discussed in the beginning. The type 1 is most common type in dogs and cats, and it is most important and most common type, especially in case of dogs. it is more severe. Type 1 is more severe because it's more severe because there's absolute lack of insulin, and it may lead to ketoacidosis, diabetic ketoacidosis, if it is untreated. Now we will read about diabetic ketoacidosis further as a separate topic. On the other hand, non-insulin dependent or type 2 diabetes, it is rare in dogs, so it will most commonly be seen in cats, especially obese older cats, and it is less severe because there is still normal amount of, like some amount of insulin is still produced in this case, and it will not cause diabetic ketoacidosis. Now the causes for type 1 or insulin dependent diabetes is pancreatitis, immune destruction of beta cells, it's inherited in certain breeds, amyloidosis in cats. There's an important point for type 1 diabetes, that is intact female dogs are predisposed to diabetes mellitus because diestrus is a very important cause of insulin resistance in dogs. What happens in diestrus is there is progesterone induced insulin resistance. The progesterone will stimulate mammary gland production of growth hormone, and growth hormone is a potent insulin antagonist, so it will not let insulin do its work. On the other hand, the causes for type 2 diabetes is down regulation of insulin receptors in obese pets. So the pets that are already obese, like insulin will tend to not do its work properly. Insulin receptor antagonism by excess hormones like growth hormone. This is very important. Growth hormone in, for example, acromegaly in cats. We already know that type 2 is more common in cats. Or due to stress, which means there will be high cortisol levels in cats. There's a point to be noted. In cats, even a visit to the vet can spike glucose. So cats are very prone to diabetes or glucose spikes due to stress, or even adrenaline. In acute stress, adrenaline will antagonize the effect of insulin. The other reason can be deficiency of thyroid hormone, obesity. Now the clinical signs for diabetes mellitus, obviously, as we discussed earlier, are polyphagia with weight loss, PUPD. Another sign is UTI because there is immunosuppression, and the glucose in the urine is a good source of energy for the bacteria to grow. So UTIs are common. Cataract in dogs is a very common sign and very important for Navle as well for diabetes. Why? Because the excess glucose that is in the blood, it diffuses into the lens and enters the sorbitol pathway. What is sorbitol pathway? Glucose is converted to sorbitol, which is another form of sugar, through the enzyme aldol reductase. This sorbitol is further converted to fructose. Fructose increases the osmotic pressure of lens and destroys the lens fibers, and it is non-diffusible, so it cannot diffuse out of the lens. Hence, it will cause cataract, that means opacification of the lens. So you are likely to experience or hear about blindness, that the dog is running into objects and has timid behavior. That's another sign. Like if there is something that signifies blindness and the other signs, it is likely cataract due to diabetes mellitus. Now the blood picture will show what? PCV will be increased. That means it will be due to dehydration. Next one is neutrophilic leukocytosis with toxic neutrophils. This is a sign of inflammation and infection. This is only seen if pancreatitis or infection is present. So the main important point is increased PCV due to dehydration. In biochemistry, you will obviously encounter hyperglycemia. Normal glucose levels for small animals are 80 to 120 milligram per deciliter. So there will be hyperglycemia, there will be hypercholesterolemia, there will be decreased sodium, chlorine or chloride or potassium ions because of PUPD, because there is electrolyte imbalance because the electrolytes are being lost. Then there's another thing, there might be increased ALT, ALP due to secondary hepatic lipidosis, because there are more free fatty acids now that are accumulating in the liver. And where do these free fatty acids come from? Through lipolysis, the fat breakdown, because the body needs energy. So this is what you will observe in the blood picture. Urinalysis will show glucose-urea, obviously, again hallmark. Specific gravity is more than 1.015, and you can occasionally encounter UTI or proteinuria, these are not that important. So glucose-urea is important, hyperglycemia is important, increased PCV is important. Now we'll come to the most important part, that is treatment for NAVLE, and it's very important. We need to know all the different types of insulin that we can give. The treatment obviously involves giving insulin. So there are 5 types of insulin that we have to remember, and their duration, their concentration, and their use. So the first one is regular crystalline insulin. This is the only insulin that can be given IV or IM other than subcut. Rest all other the insulins are given subcut. So first of all, regular crystalline insulin, it is short acting. The another one is NPH. It's also known as Humulin. It is intermediate acting, and Lente or the porcine insulin is also intermediate. So there's one short acting, that is regular crystalline. There are 2 intermediate insulin, NPH and Lente, and there are 2 long lasting or long acting insulin, PZI and Glargine. This is very, very important. The concentrations are 100 units for all except Lente and PZI, which are 40 units. So again, I'll repeat. Short acting is regular crystalline, intermediate is NPH and Lente, and long acting are PZI and Glargine. The concentrations for regular crystalline, NPH and Glargine are 100 units. For Lente and PZI, they are 40 units. This is very, very important for NAVLE. And now we come to the use. The regular crystalline one, as I already told, it is short acting, and it is short lasting as well. So this is the only form that can be given IV or IM or subcut. Rest, the other 4 cannot be given IV or IM. They can only be given via subcut route. The regular crystalline, since it's quick and short acting, it is used for emergency, which is DKA, diabetic ketoacidosis, and it's not used for maintenance. So regular crystalline insulin is only used for emergency cases. The next 2 that are intermediate acting, NPH and Lente, they are good for dogs. And the drug of choice for diabetes mellitus for dogs is Lente or Vetsulin, which is porcine insulin, and it is FDA approved. So this is what we need to remember, that the first choice for dogs for maintenance or for the treatment of diabetes mellitus is Lente. NPH can also be given, but Lente is more preferred. Now for the long acting ones, PZI is given to both dogs and cats. Glargine is the drug of choice for cats. This is very important. Cats have faster glucose metabolism, so long acting ones are useful. If you give intermediate one, you'll have to give it thrice a day or like in multiple doses, which is not practical. So it's better to just give long acting drugs, insulins, to cats. So now drug of choice for dogs is Lente, drug of choice for cats is Glargine, and for DKA treatment, which is a very important topic as a separate topic for NABLE, for DKA or emergency, regular crystalline insulin is given. Extra information: NPH and PZI contain protamine, which is a fish protein, and zinc that slows down the subcut absorption. So that is why they are not short acting. They are intermediate and long acting. Lente, what's special about Lente? It relies on zinc content and the size of zinc insulin crystals. So there's zinc in it, and there are smaller crystals and larger crystals in Lente. The smaller crystals, they are quick and they have a quick and short effect. The larger crystals, they are absorbed slowly and they have a long lasting effect. So that is how Lente works. There's another special point about Glargine. It has a pH of 4.0, which is not the normal physiological pH. Normal physiological pH is 7. So when you give Glargine, when it is injected subcut into under the subcut tissue, it precipitates because of the difference in the pH. This precipitation or the micro precipitates that are formed, that are slowly absorbed throughout the day. This is why it's long acting. Lastly, there's a very important point for dogs and cats, that is diet. What kind of diet do you give in diabetes mellitus? And it's very important for NABLE as well. For cats, since they're carnivores, they need a low carb and high protein diet. High protein, low carb. This is very important. And for dogs, the diet has to be moderate to high fiber, because dogs can take fiber. So moderate to high fiber and low carb, low fat diet. This is very important. There's another objective that is very, very important, which is oral hypoglycemic. There's an oral drug that can be used for the treatment of diabetes mellitus, only effective in cats. So it's only useful in cats, and its name is glipizide. It is a sulfonylurea drug, and it stimulates insulin release in cats, so not to be given in dogs. You need to know the name of the oral hypoglycemic drug. Another point that was mentioned in vet prep is, in animals normally the glucose is spilled into urine when the blood glucose is, for dogs it's about 180 milligram per deciliter, and in cats is 200 to 280 milligram per deciliter. So when the glucose levels reach these levels, the glucose will be spilled in urine. But as we read before, the normal glucose levels in the blood are 80 to 120 milligram per deciliter. Now for cats, you can start with Glargine, and the dose of Glargine, it depends on the blood glucose level. We don't have to remember dose or the blood glucose levels. You just need to know what drug is to be given. And in dogs, you start with Lente mostly, or NPH, and the dose depends on the body weight. In dogs, it's important to reevaluate once a week after you start the drug, and you have to check until they are under the glycemic control, and it takes about 1 month to for this, and then after that you have to reevaluate every 2 to 4 months. Now how will you reevaluate? You will you will do physical examination, you'll check the body weight. Now here's another very very important key concept for NAVLE, which is GHB, blood glycosylated HB, or serum fructosamine. Serum fructosamine is glycosylated albumin. So there are two things. There's HB that is glycosylated, and there's albumin that's glycosylated. These are the markers that are used to measure long-term glucose in the blood. So this will give you an idea of how the glucose curve has been, how the glucose in the blood has been for the past few months, so you can have an overall picture of how's your patient doing. First, I'll tell you about GHB, which is glycosylated HB. It is the HB molecules, the HB that has glucose molecules attached to it irreversibly. So when there's excess glucose, this excess glucose in blood tends to bind with HB and form GHB. In diabetic, what's the significance? In diabetic dogs, due to persistent high blood glucose levels, the increased glucose molecules will bind to HB and they will be irreversible. The binding will be irreversible. And since the average lifespan of RBCs is roughly 120 days, and in cats it's 60 to 70 days, the half-life, that means for how long will you find these GHB molecules, will be 2 to 3 months average. This is very important. Why 2 to 3 months? Because that's the average lifespan of RBCs. See, the glucose is bound to the HB, and the binding is irreversible. So these molecules will leave the body only when the RBC has finished its lifespan, which is 2 to 3 months average. So this 2 to 3 month period will show you the average long-term glucose levels when you measure GHB. The another one is fructosamine. Fructosamine is glycosylated protein or albumin formed when glucose binds with albumin. So in this case, the glucose binds with albumin. In GHB, it was bound to HB. This is preferred. This is a preferred marker because it reflects average blood glucose levels over a shorter period of time, which is 2 to 3 weeks. This means that the fructosamine has a shorter half-life because the albumin has a shorter half-life as compared to HB. So this is very important that serum fructosamine is used to differentiate between transient hyperglycemia or stress-induced hyperglycemia and persistent hyperglycemia or true diabetes mellitus, especially in case of cats. So what happens is, if there's stress or there's transient hyperglycemia, the fructosamine levels will be normal because the glucose spike is transient. It can be due to stress. So for a small period of time, the glucose levels spiked, but the animal is not diabetic. But if the animal is diabetic or there is persistent hyperglycemia, the fructosamine levels would be high. So this is very important for NAVLE. So the last topic is handling diabetic crisis. Diabetic crisis involves two things: hypoglycemic crisis and ketoacidotic crisis, also known as DKA. Diabetes mellitus can lead to. First one is hypoglycemia. Why can hypoglycemia occur? Because when you give insulin for the treatment of diabetes mellitus, it can lead to hypoglycemia. the insulin can be excess or the body can respond to it, so that the glucose levels that were high in blood, that is hyperglycemia, the insulin given for treatment, the drug that you give it, will lead to hypoglycemia. So hypoglycemia is a crisis when animal receives excess insulin or vomits it or fails to eat the correct amount. So the clinical signs will be blindness, cerebral edema, seizures. These signs are transient and they evolve with time. When the hypoglycemic state, it is reversed. And why are these signs seen? Because the brain is very prone to hypoglycemia. Brain needs glucose, and the brain is the first organ that is affected when there's hypoglycemia. So what's the treatment if you see that your animal is hypoglycemic? You have to discontinue all insulin. Whatever drugs you are giving to treat diabetes mellitus, you have to discontinue it, and you have to administer Karo syrup, Karo, which is corn or pancake syrup. It's sugary. You have to give it orally so that you give a source of glucose sugars. Then place the dog on 5% dextrose, which is again a sugar, to stabilize the blood sugar until the animal can be fed. Do not give insulin until hyperglycemia returns. So you have to wait until the hypoglycemia eventually turns to hyperglycemia, and then you can treat for diabetes. The second part of handling diabetic crisis is DKA, diabetic ketoacidosis, which I will discuss as a separate topic. It's very important for NAVLE. There's definitely 1 or 2 questions related to diabetic ketoacidosis.